Good evening. Chair calls to order Board of Health update, Spring 2022 Board of Health update. Council, I'd like to welcome Ms. Austin with us this evening, along with Felicia Hopkins, Michelle Peterson, Rick Ayers, and Lisa Swank, and it looks like several others as well. So whenever you're ready, Ms. Austin.
Thank you. So good evening, Council President Vincenti and members of the Council. I'd like to thank all of our staff for coming tonight. We owe them a round of applause for all the work they've done. So for the agenda, let's go here. For the agenda, I'll go over the Harford County Health Rankings, some additional funding we've received, the HUD grant, and then I'll highlight some of our programs. After that, I'll introduce our guests this evening to discuss minority health and our peach bottom drills and evaluations. First are our 2022 County Health Rankings by Maryland jurisdiction. The County Health Rankings provide a revealing snapshot of how health is influenced by where we live, learn, work, and play. They provide a starting point for change in communities, and we use much of this information when developing new programs. Harford's health rankings remain the same for 2022 as in 2021. Here are some of the health indicators from the 2022 County Health Rankings, and we have listed just a few samples of where Harford is doing better than the state and where we're doing worse. We're doing better than the state in these health indicators. For child mortality, this is the number of deaths among residents under age 18 per 100,000 population. In Harford County, there were 30 deaths per 100,000 residents, compared to 50 deaths per 100,000 residents across the state. For teen births, this is the number of births per 1,000 female population ages 15 to 19. In Harford County, this is 9 births per 1,000 females compared to 15 births per 1,000 females across the state. An uninsured percentage is the percentage of the population under age 65 without health insurance. In Harford County, 5% of our residents are uninsured compared to 7% across the state. Oh, I'm sorry. We're doing worse than the state in these health indicators. Adult obesity in Harford County, 16% of the adult population, and that's age 18 and older, are considered obese compared to 13% across the state. Poor mental health days is the average number of mentally unhealthy days reported in the past 30 days. In Harford County, this is an average of 4.3 days compared to 4 days across the state. And adult smoking is a percentage of adults who are current smokers. In Harford County, this is 16% compared to 13% across the state. So I'd like to thank County Executive Barry Glassman for approving an additional $200,000 of federal funds to assist in meeting additional needs in the Health Department's Environmental Health Bureau. This funding will help with staffing to meet increasing requests for permits. Permit requests have grown exponentially over the last few years. And thank you also to Council President Vincenti and councilmen for advocating on the Health Department's behalf for additional funding. Next, an update on the HUD grant. Funding for the Health Department of $1 million over a 3-year period was officially approved on February 11th, 2022. The purpose of the grant is to make safety and functional home modifications and limited repairs to meet the needs of low-income elderly homeowners living in Harford County. The Health Department worked with County Procurement to develop the request for proposal, and bids are due by May 25th. Both entities followed all HUD's requirements for a competitive bid process, and I want to thank Karen Myers, Director of County Procurement, and her team for their assistance with this RFP and helping us to put this grant on track. And now for some program highlights. I'll be updating you on some of the Health Department programs you may already know about, but I'll also introduce you to the great work being done in programs you may not be aware of. We'll start with the dental clinic and school-based dental program. Our dental clinic strives to improve the oral health of children ages 1 through 20 on Medicaid, and pregnant and postpartum women who are Medicaid eligible. Generally, the clinic has about 4,500 visits per year. We also have a school-based oral health program in partnership with HCPS that has resumed its services in 10 Title I schools. Dental education is provided to all classes, and direct dental services are provided with parental consent. In addition to education, the second, third, and fourth graders are provided dental screenings and dental sealants, which is a protective coating on their molars. Pre-K and kindergarten students are provided dental screenings and fluoride varnish. Next is our Wic program at One North Main. The One North Main Family Health Center has had approximately 300 Wic participants receive nutritional services since its opening in July. Wic services are offered at this location twice a week and serves 3 other locations in Edgewood, Havre de Grace, and within the Cecil County Health Department. Also at the One North Main location, we will start serving children on medical assistance and pregnant and postpartum women who are Medicaid eligible in the new dental clinic starting next week, when we welcome our new trilingual pediatric dentist, Dr. Carolina Rojas. Let me go to the next one. We would also like to highlight the Medical Assistance Transportation Program. This program assures eligible Medicaid participants access to care by providing non-emergency ambulatory, wheelchair, and ambulance transportation to health care appointments. Additionally, the program covers return trips from hospital emergency visits, return trips from hospital stays, and medically necessary inter-hospital transfers. Medical assistance transportation typically provides up to 100,000 transports a year. Next is Hepatitis C is just one of our programs within the Clinical Health Bureau. Hepatitis C is a leading cause of liver cancer. 47,000 to 73,000 Maryland residents will contract hepatitis C in their lifetime. 1 in 3 young people who inject drugs have hepatitis C. Acute Hep C infections reported to CDC quadrupled from 2009 to 2019, with injection drug use being the most reported risk factor. Reaching more people with Hep C and offering testing and treatment is critical to saving lives and preventing transmission of this deadly but curable infection. So at our clinic, we have over 70 individuals enrolled in care for Hep C. 35 have been cured, 14 are currently receiving treatment and are close to cure. 22 have been lost to follow-up because prevention and cure are low priorities if other issues are going on. We have strong relationships with local treatment centers for testing and referrals to our services. Once engaged in Hep C treatment, clients utilize other health department services such as immunizations, sexual health, behavioral health, drug user health, and family planning. We have another program called Healthy Families, Harford County, which is a free program that provides home visiting services, including prenatal development, parenting, child development, health care, and local resources support by trained family resource and support specialists until children reach 3 years of age. Healthy Families, Harford County holds monthly parenting support groups to share information and provide socialization opportunities for parents. All pregnant women and families with children under 3 months of age living in the Harford County are eligible to be screened for service. This program helps parents to take action in reducing life stressors and maximizing opportunities to bond with their babies during and after pregnancy. Healthy Families is preparing for its second accreditation, which is due in July. Our home visiting pilot program is preparing to end, and its success has led to a statewide expansion for all home visiting sites to now bill Medicaid directly for home visiting services. We will begin the expansion in FY23, and the goal is to continue to expand our services to more families in Harford County. So we had 8 families graduate from our program in 2021. And here are some pictures of our graduates. I promise the graduation is way more exciting than the picture in the upper left corner indicates. Graduation will take place, 11 families and 12 targeted children will be graduating next month at Megan's Place on June 16th. Our Lead and Asthma program is a home visiting program led by nurses and community health workers. The program provides education about maintaining a healthy home, helps identify and reduce irritants and allergy-causing agents that exacerbate asthma symptoms, and it helps identify sources of lead in the home which can cause elevated lead levels. The program conducts 3 to 6 visits in person or virtual visits with the family depending on preference. We provide information, educational materials, and tools and supplies consisting of the items on the list here. So that includes mattresses and pillow covers, medicine containers, HEPA vacuum cleaners, doormats, green cleaning supplies, and pest management kits. Next is a glimpse of our Environmental Health Bureau structure. So environmental health has 3 program areas: inspections, permits, and plan review, and land and water resources. John wanted me to let you know that environmental health inspectors must have at least a certificate of eligibility from the Board of Environmental Health Specialists for employment at the local health department. The position requires a bachelor's degree with at least 30 science credits, and there is at the least a 12-month training period. And the specialist must pass the national licensing exam before their training certificate expires, which is 3 years from the date of hire. And here you can see the 3 program areas and the work that is done within each. Also, I'm happy to say that John is in the house tonight and can answer your many environmental health questions. So, and finally, we have our behavioral health program, and this includes behavioral health services for adults, for youth and adolescents, and the local addictions authority. Services for adults and youth are direct clinical services and include individual therapy, family therapy, group counseling, medication management, and peer recovery support services. Our local addictions authority monitors countywide initiatives and grants related to the provision of treatment and recovery support services. And since this is Mental Health Month, Andrea Pappas, the Director of Behavioral Health, and I will be staying for the next meeting to receive the Mental Health Month proclamation from the Council. So it's nice to present a snapshot of just a few of the amazing programs we have within our health department after a tough 2 years of battling COVID. We are humbled by our true purpose to serve all the citizens of Harford County, particularly those who are vulnerable and may need safety net services. In the words of Mr. Rogers, life is for service. I wholeheartedly thank our staff for the service they provide to our community and thank all of you for your support. So next, I'm gonna introduce Felicia Hopkins and Michelle Peterson from our Minority Health Unit, 2 amazing ladies and wonderful additions to the health department staff. These 2 have taken the health department outside of the box from our mostly mandated services with their creative programs and their keen awareness of the community they serve. So welcome to Felicia and Michelle.
Thank you, Marcy.
Real close.
Can you hear me?
Yes.
It's pretty good, okay. And hello, my name is Felicia Hopkins.
And I am Michelle Peterson.
And we are community health workers with the Harford County Health Department since April of 2021. We have visited and helped address health disparities and public health issues plaguing the Edgewood, Aberdeen, Havre de Grace, and Joppa areas. During our time at the Health Department, we have reached over 500 families with resources such as COVID vaccinations, gift cards, and connections to care coordination services and events. While performing outreach to these areas, we have created monthly programs that directly affect these communities, such as biweekly broadcasts, where we bring experts to discuss topics of the pandemic, issues and help related to diabetes, high blood pressure, and other major health issues that our data has shown plague our community. Last April, at the height of the pandemic, we addressed vaccinations, testing, masking, and other COVID misconceptions. Additionally, we brought Life Camp from New York City and their Peacemobile to address the gun violence in the Edgewood neighborhoods. We have partnered with Healthy Harford and Upper Chesapeake Medical Center, which offered classes of pre-diabetics as well as African-American men with diabetes. The importance of drinking water and providing mental health resources was also included in our outreach. We have gone into the communities with programs such as Dinner and a Book at the Edgewood Boys and Girls Club, Let's Spill the Tea, in which we discuss the benefits of drinking herbal tea and journaling. We have had Chef Catherine Brown, a local culinary expert who dedicates her craft to healthy eating, and presented at the Village of Lakeview. All participants walked away from that event with a crock pot and recipes. We had a smoothie sip and paint highlighted how to make healthy smoothies. We are presently working on a summer series, Let's Get Moving, which focuses on not only mental health, but our health in general, Right here in the month of May, which will be accumulated with a mental health lock-in geared towards our young men, May 20th at the Aberdeen Epic Center, which is this Friday. We meet with community stakeholders every month, which include our local minority churches, CBOs, which is community-based organizations, and a few state elected officials. These meetings are centered around addressing the needs of our community by providing not only resources, but also solution-related topics that include our food deserts, Title I schools, transportation, and more. We look forward to continuing to be a vital resource and create more safe spaces for our minority community to address ongoing health and public health needs. Thank you.
Thank you, Ms. Hopkins.
That's out of the box. Thank you both. So next up, we have Lisa Swank. Next up, we have Lisa Swank, the Health Department's Emergency Preparedness Coordinator, and Emergency Manager Rick Ayers from the Department of Emergency Services. They will be discussing our recent Peach Bottom exercises, drills, and evaluations. When it comes to emergency response, you'll want Lisa and Rick in charge. I would venture to say that they are the best across the state. The Health Department cherishes its long-time partnership with the Department of Emergency Services. So welcome, Lisa and Rick. And I think you're going first, aren't you?
Thank you. No pressure over there.
Okay, well, you're great.
So Lisa told me I have 10 minutes, so I'm going to try to use that 10 minutes to tell you what happens. Yes, 5 minutes. 5 minutes. Thank you, Councilman. I'm going to use that time to explain to you what we have to do in Harford County because of Peach Bottom being a couple miles across the state line in Pennsylvania along the Susquehanna River. So because of the power plant being there, we have to go through a federally evaluated exercise by the federal government every 2 years to make sure everybody in Harford County that would have a role if we would ever have a release from the power plant knows the plan, knows what to do. If we have shortcomings, figure out what we need to do to fix them. So that's the purpose of the exercise every 2 years. With COVID, we actually did not have the exercise like we normally would 2 years ago. So there was actually the exercise we just finished. It was the first time in 4 years that we went through the full exercise, and I can honestly tell you that I'm so proud of everybody that has a role in Harford County because we came through the exercise with flying colors and had a lot of great feedback and comment from the federal evaluators. Another reason why I think it's great in a way that we have to go through this exercise, because I go around the state and go to a lot of counties that does not have to do this federally evaluated exercise, and I can tell you that we're so much more prepared for almost any disaster in Harford County because we have to go through this every 2 years. So the power plants across the country have 4 declarations that can be declared for an incident at the power plant. An unusual event and the alert level are the 2 lowest levels, and from time to time we will have an unusual event or an alert declared at the plant for something small, nothing that would become newsworthy, and in most cases nothing that would even require the EOC to be activated. It would just be something that I, as the emergency manager, would be made aware of and would monitor the situation. However, when we get to what they call a site area emergency or a general emergency, there is a major problem at the plant that would require several things to happen. The first thing that we would do is activate the EOC. We would bring everybody into the Emergency Operations Center and brief them on what's going on at the plant. And then we would, at that point, we receive our notifications from the plant itself into the 911 center. They notify me, they tell me what's going on, and when we get to a site area emergency or general emergency, the plant will actually give us recommendations that they call off-site recommendations, and then we will get on the line with Pennsylvania, the state of Maryland, and we have 5 counties that also have to be on the call. The area that we're most concerned about is the area from 0 to 10 miles, 360 around the plant, and that involves 2 states and 5 counties. So we have to get all of those agencies on the phone, talk about the recommendation from the plant, and then decide whether we want to take the recommendation that they offer us or whether we want to change it for our jurisdiction. Some of those recommendations that would come out if there was a release from the plant is we only have 2 choices for the people in the 10-mile area in the northern part of Harford County. We can either tell them to stay there, which is shelter in place, or we can tell them to evacuate. It really is that simple. That's our 2 choices. And if we tell them to evacuate and there's a release already in progress, they could be potentially contaminated. So at the same time that I'm making arrangements to do that, Lisa and her staff is opening up 2 reception centers in the county, one at the college and one at Falston High School. And we're going to tell all the people in that 10-mile area of Harford County to report to one of those 2 reception centers. If you're not aware of the population in our 10-mile area of Harford County, that is around 12,000 to 13,000 people, and that's a lot of people to get to 2 reception centers. The federal government said to get those people out of there should take us around 6.5 to 7 hours. So that will be one of the recommendations. At the same time, we will be opening up shelters at some of the other high schools in the county. If schools are in session, we're going to evacuate the kids from the schools in the 10-mile area and get them from the schools that they're currently at, bus to a host school outside the 10-mile area. We also are going to have the state go in with monitoring teams from the Maryland Department of Environment. So they'll be right away in Harford County with their monitoring equipment and telling us what the radiation levels are in the 10-mile area. We'll tell the farmers to put all their animals on stored feed and water before they leave. The way we notify the public, which is always a question I get a lot when I go out and speak to the people in the public, is we do have a siren system that the Exelon provides that's in the 10-mile area. The key, though, is if people hear the siren blow, do they know what to do? and they're supposed to turn to the radio station, which for us is 103.7 WXCY in Habitat Grace, which is our primary radio station. And we will have additional information on what we want the public to do if they hear the siren sound at Peach Bottom. And we will also use our emergency notification system that you hear me use from time to time for weather events. We will also use that system for the people in the 10-mile area to tell them what to do. The people that are responsible to help us manage this in the EOC, we would have around 80 county agencies in our emergency operations center that all have checklists to follow for each different classification level at the plant. So as long as they're following their checklists, then we shouldn't have a problem. They know what they're responsible for, and they just follow their checklist that we already have as part of our Peach Bottom plan. As you know, that if in watching some of the events that have unfolded at Fukushima and some other places in the world, this is not something that would be quick. It could last days, weeks, months, years. We hope it never happens. But I feel, as the emergency manager, if it did, that Harford County is very prepared. And with that, I'm going to turn it over to Lisa, and she can talk a little bit about the role the health department has.
So FEMA actually grades us on how well we communicate with our partners, and I think, as Rick pointed out, that's one reason why the Harford County is, I think, one of the counties that's ahead in terms of emergency preparedness, because we've had to do this exercise for many years. We know our partners and we know how to communicate, and we consider our partners friends. We can go to them for help. We know where the resources are. So the health department actually is responsible for staffing those community reception centers that Rick spoke of. And again, there's 2 locations, and we really can't do it without the Harford County Health Department employees. And I'll just give a shout out to our Environmental Health Division. They are the backbone in terms of helping us with staffing this. They work with us at these every 2 years, and we have other employees that also help us. Our nurses help with staffing the shelters. So we're quite involved in trying to make sure that our residents are taken care of, and that we're educated in how to operate the radiological equipment, such as portals and the Geiger counters that we call Ludlums, and all the different instruments that we use to help protect not only the community but our employees as well. One of the things I wanted to just briefly speak about is potassium iodide. This is something that we actually distribute to those individuals that live within 10 miles of the power plant. So again, that's our northern part of the county. We have distribution days that we do at North Hartford High School when we need to redistribute. If those potassium iodide pills expire, we actually give out free new ones for those individuals to make sure that they have those in the household if we would need them to take it. So I just basically wanted to just talk a little bit about potassium iodide. It is a salt of stable iodine in pill form. It's essential for the proper functioning of the thyroid gland, which is used to make thyroid hormones. So if you know somebody that takes Synthroid, that's because their thyroid is not working properly. So this is the same gland that we're talking about, and this gland actually removes iodine from the blood into its cells, and it concentrates it as iodide. And what the thyroid gland does is it uses this iodine to make thyroid hormones. And that's important for a variety of reasons, for in terms of coordinating and creating the use of energy. So one of the symptoms, if your thyroid's not working correctly, is you get fatigued quite easily. It regulates your heart rate, blood pressure, and body temperature. So it's just one of the protective actions that might be considered. It would be ordered by the health officer if people would need to take it. And one of the things that it does is it protects the thyroid because you're actually administering a healthy iodine to the thyroid. It absorbs it so that it doesn't absorb the radioactive iodine. So therefore, we're protecting the gland, okay? And the other thing I just wanted to talk about a little bit is the fact that why are we concerned about radioactive iodine? And that's because it's one of the most abundant substances in the cloud of radioactive steam that's released by a failing nuclear power plant. So you may not find radioactive iodine, say, you know, in a nuclear device that would be detonated, but you would always find it in a fixed nuclear facility that would perhaps release iodine in an accident. So that's why we really focus on these exercises. We focus on the potassium iodide, and we focus on how we can monitor and decon individuals when they come out of that area if there is a possible release. And that's what those community reception centers do. We actually have people walk through, monitor the portal monitor to see if they actually have radioactive dust, an actual dust on them from, you know, above, if it's released. And then if they do, we actually decontaminate. And decontamination is not really a scary thing. It's basically simply using soap and water to remove that so that it doesn't penetrate into the body or go through the skin and cause damage. So it's a lot of interesting things that we have to learn for this exercise, and Harford County Health Department staff has been tremendous in taking on that task. And again, it's for the benefit of the Constellation Power Plant, because if they don't have a community that's willing to protect their residents, they can't operate. And so we feel like it's a duty not only to the power plant, but especially to our citizens. So thank you.
Thank you, Lisa. That's it? We're on a roll. First of all, let me thank you for assembling everyone and bringing them here today. And Dr. Moy, I apologize for not calling you out earlier. I didn't even see you till just a few minutes ago. I'm sorry. We truly appreciate all that the team does on a regular basis, on a daily basis, to help keep our citizens abreast of all types of health issues and health needs. And with that, I'm going to open it up real quick to my colleagues for any type of questions. Anyone? Mr. Bueller?
Thank you, Council President. How you doing, Marcy? Good. Thanks to all the rest of your team. But my question is for Ms. Felicia Hopkins. And give a minute. I know we've spoken on a couple of occasions. As far as the minority community, I know you're working there and everything, but do you have anything in place as far as nutritional education? Because I think that's a huge need. Or are you planning on to expand your services to provide, you know, something like I said, because, you know, you get your nutrition right, that'll probably take care of a lot of the health issues. Are you looking to do anything there, or?
To answer that in two
I'd be
parts.
supportive of it.
Yeah, well, I can answer that in two parts. We just recently, at our Community Advisory Board, partnered with Crown of Life, and they have obtained the Obesity Grant, and that started April 26th. And so that is located right in Edgewood and was opened up to everyone in Harford County. We had them come on our biweekly broadcast, Let's Talk About It Live, where they were able to engage the community and those that were on either Facebook or YouTube with those questions and be able to sign up. We also, for the summer program, we're titling it Let's Get Moving. And so that is going to include walking, healthy eating, exercise, and the like.
No, I just, you know, I would like to see something more, you know, in working with, I know some of the churches, you know, they have little small programs and things like that.
We know how that goes sometimes.
Yes.
But we are open to reach out to all of our churches. That's why we have our Community Advisory Board partnering with our churches, our local churches, with health issues and health disparities and things of that nature, and healthy eating especially. So if you have anyone that is interested in partnering with us, we would be very open to that.
I would just like to see some type of coordinated program, you know, because it's like, okay, this church is doing a little bit here and this group is doing a little bit here. And especially, yes, we need it for the adults, because, I love some fried fish. The church is having a dinner, I'm getting some fried fish, I'm there. But, something especially for the youth, because if we get them in those good eating habits early, then they maintain them. So, if you come up with any ideas or anything I can do to support something along that, Marcy or whatever, I think that is needed.
Absolutely, absolutely. I will definitely reach out to you. Thank you.
Thank you, Felicia. That's all I have, Council.
Thank you, Mr. Buell. Anyone else? The other thing I will comment on just briefly, while I have everyone here, is this past week I had the opportunity to go out in the field with members of the environmental department and kind of observe some of the testing that they do on site. I see Len's here, and John set it up. Thank you for that. So I think it's beneficial for all of my colleagues from time to time to get out in the field and visit with all of you to better understand what you do on a regular basis, the extent of what you do, the reason why the regulations are the way they are, the enforcement that you have in place. I think it's better for us acting as the Board of Health, and I know that we all feel sometimes inadequate to sit here and do this. So anything that you can do to help us better understand the process, we'd appreciate. Thank you for that. Mr. Wagner?
Yeah, I'm looking to see exactly what you call it. The programs that you have out there that basically would be, many will term it harm reduction in terms of addiction services and things. I know we've asked for it, at least I think we've asked for it. If we haven't, we're going to, but I'll ask you now. Does anybody here have an idea of how many, how much Narcan you guys have? All right.
I did just get that report from Clinical Health. I don't know if Linda has that in her hands right now, but I think I forwarded it to Debbie.
Okay.
So.
And why I ask is I know we've got some more private agencies out and around, and the numbers that I've seen from them are impressive, not in a good way. Well, depends on how you view it.
Yeah.
It shows participation in the program.
Mm-hmm.
It also gives you a little bit of a barometer of how much of a problem we have in and around our communities.
Yes.
So when you get those numbers, I mean, as I said, when I got these, I said, that's just one
One
particular
agency, right.
site, and you guys are giving out probably as much or even more. So the numbers are going to be substantially higher in all aspects of what we would term harm reduction.
Yeah.
So I'd be curious to see what they are, and then we'll have chats about that later to see where that goes.
I think we can reach out to the state. I think that's what our next step was. But I think there was an estimate of how many are given out at other agencies too. So let me re-forward that to you.
Okay, all right, thank you.
Okay.
Yep, thanks.
Thank you, Mr. Wagner. Mr. Buell?
Yeah, just one quick question, just for curiosity. Rick, what's the shelf life of those iodine tablets? On average, just curious.
It's usually about 10 years.
10 years? Okay, that's what I'm just curious. Thank you, Council President.
Thank you, Mr. Buell. Anyone else? All right, with no one else, then we will conclude this update and move on to Board of Health appointment, Office of Mental Health Core Service Agency at Harford County. May I have a motion?
Council President.
Mr. Schroeds.
Council President, I make a motion to approve the appointment of Jennifer Redding to the Office of Mental Health Core Services Agency.
Thank you. May I have a second?
Second.
Thank you, Mr. Wagner. It's been seconded to approve the appointment of Jennifer Redding to the Office of Mental Health Core Service Agency. Is there any discussion? Ms. Dixon?
Mr. President?
Aye.
Mr. Woods?
Aye.
Mr. Schroeds?
Aye.
Mr. Wagner?
Aye.
Mr. Beulah?
Aye.
There being 5 votes in the affirmative and 2 absent, the appointment is hereby approved. Before I go any further, let me say that Councilman Johnson is not with us this evening. He has COVID. And Mr. Jan Giordano is under the weather, but will be here he'll be here tomorrow for some other things. With that, we will stop as the Board of Health and open up for public hearing.
Not yet.
Not yet? 6:45, we're going to wait. Okay. So then we will
4 minutes.
take a recess. Chair calls to order public hearing for Bill 22-007, Charter Amendment, Removal of Council Member. Mr. Wagner.
Bill number 22-007 was brought to you after a review of the charter. The charter does provide for a mechanism to remove the county executive for certain reasons. It prescribes how you do that and why and what instances. But in review of it, the charter didn't mention or have anything to say about council members. And not that we've had any instance up until now, but you never know going forward in the future that there could possibly be a reason that would be the same as what it would be for removal of the county executive. And I just thought it was important to at least take it before the voters and have them look at it and decide. It just seems like it was something that was left out of just mere lack of thought that there would be a reason to remove a council member. But I think in moving ahead, it should have basically the same provisions for council members as it does for the county executive. So that's why I brought Bill number 22-007 forward.
Thank you, Mr. Wagner. Anyone else, council? Ms. Dixon, do we have anyone signed up?
We do, Mr. President. We have one this evening, Emma Peller.
Good evening, ma'am.
Hello, I'm a Peller. My address is on file. Thank you for the opportunity to speak with you this evening. I'm here in support of Bill 22-007, Charter Amendment for Removal of Council Members. In the week leading up to this meeting, I've talked to some who say that waiting half a year is too long for removal, that the period in which they go with unequal representation should be shorter, and request that you keep that in mind. Regardless of the amount of time, the bottom line is clear here. The citizens of Harford County deserve representatives that will show up for them. At the very least, fulfilling the duties of the office, like considering and voting on bills, and being physically present at council meetings, since we do not yet have a way for council members or citizens to participate virtually. When circumstances get in the way that prevent those responsibilities from being fulfilled for months at a time, we deserve a new representative who will show up for us. Please put your constituents' interest first and vote yes for Bill 22-007. Thank you.
Thank you, ma'am.
There are no more speakers, Mr. President.
Thank you, Ms. Dixon. With no one else signed up, this will conclude the public hearing for Bill 22-007. Bill 22-008, Zoning, Entertainment, and Events Center. Ms. Jarkowski. Good evening.
Good evening, Mr. President and members of the council. I am Jenny Jarkowski, Director of Planning and Zoning. I am pleased to present to you this evening this piece of legislation for entertainment and event centers that we believe will further mixed-use development in Harford County. While the code does already address mixed-use options that incorporates residential uses in a commercial center, the code lacked the integration of mixed uses along with entertainment, amusements, retail, and office space. In drafting this legislation, Planning and Zoning included setbacks to residential and industrial districts, additional buffering, and making this a special exception. The special exception will allow for each project to be reviewed individually by the Board of Appeals, who could also include additional conditions based upon the application. In addition, this ordinance requires 3 different uses be present and in use at the site at all times. Furthermore, 1 use must be from the amusement section of the ordinance and 2 uses from the retail, trade, and service uses. This requirement will ensure that these centers maintain the mixed use of the property. The legislation addresses a 5-acre minimum, must be served by public water and sewer, outdoor activity times, and ensure that lighting is appropriately controlled. Thank you for your time, and I will answer any questions that you may have.
Thank you, Ms. Jarkowski. Council, any questions? Ms. Dixon, do we have anyone signed up?
We do, Mr. President. We have 2 this evening, John Malamo, followed by Brad Stover.
Good evening, sir.
Sir, good evening to you and your colleagues. John P. Malamo, 2402 Eagle View Drive. Harford County zoning and land use is a haphazard mess. Districts are thrown in on top of each other with no regard to their consequences, compatibility, or adverse effects. While that may be acceptable to a person with a favorable zoning decision, it could be undesirable for other property owners. Zoning code changes in Harford County have these aspects in common. They are for somebody. They are deliberately vague and ambiguous to obscure scrutiny of any potentially objectionable use. They are broad in scope to avoid the appearance of spot zoning or piecemeal zoning. They do not consider the impact of surrounding property owners. They are jammed through. Too bad for you. This is no exception. Special exceptions as described by the zoning code may be permitted when determined to be compatible with the uses permitted as of right in the appropriate district by this Part 1. Special exceptions are subject to the regulation of this article and other applicable provisions of this Part 1. Obviously, this situation is confounding. The Events and Entertainment Center is treated as one special exception, but will consist of multiple individual uses. Each individual use must be licensed and permitted as required and must still conform to the zoning code and subdivision requirements of the district therein located. For example, a minimum lot size for a project in the MO district is 20 acres. This use will not meet that requirement. Uses not permitted in a district cannot then be included as a use in the Events and Entertainment Center. Please review Zoning Case 5937 for precedence and reference. Why is this necessary? How does this improve the quality of life in Harford County? Is this a backdoor attempt to put uses in districts where they are not otherwise permitted? I understand the county executive's desire for this change. It is for someone. It is good for him, and it is consistent with his desire to expand development without regard to any consequences or adverse effects. What about you? The Glassman administration has demonstrated a curious concept of enforcing the code and upholding Board of Appeals decision. Special exceptions do not consider compatibility or intensity of use. What will you tell your constituents when their peace is disrupted, when they complain of adverse effects, when they complain of noise? What will you tell them when the code is not enforced? Your mistake, you trusted me? This is exactly how the Perryman Peninsula mess was established. Please, no more Perryman Peninsula zoning disasters. Do the research on the adverse effects of this bill and vote no.
Thank you, sir. Thank you, sir.
Can I,
Mr. Wagner?
Jenny, if I could, would you be available in the upcoming week to meet with myself or maybe some other council members to discuss this bill? Okay, thank you.
Thank you.
Mhm.
With no one else signed up, this will conclude the public hearing for Bill 22-08. Bill 22-010, Pay Plan and Classification Plan. Ms. Stevens? Good evening, ma'am.
There we go. Good evening, Council President and Council members. So I am Tiffany Stevens. I am the Director of Human Resources, and I have no booklets for you this year. I have nothing to hand out because we are requesting 0 changes to the pay and class plan this year. We will revert to everything that we did in FY22.
Thank you. Council, any questions? Ms. Dixon, do we have anyone signed up?
There's no one signed up, Mr. President.
Thank you. With no one else signed up, this will conclude the public hearing for Bill 22-010. Thank you.
Thank you.
And we will take another recess until 7:30. Good evening, Chairs. Calls to order legislative session day 22-016. I would ask you to please join us standing for the pledge, followed by the opening prayer by Councilman Woods. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Creator of the universe, we ask for your blessing at this time. Allow this meeting to begin in order, be conducted in peace, and close in harmony. Amen.
Amen. Amen. As I said earlier, Councilman Johnson is not with us tonight. He has been diagnosed with COVID-19, and Councilman Jan Giordano is not with us tonight, but will be available tomorrow. Agenda item number 4, presentation of proclamations, mental health awareness. Council, I'd like to welcome Andrea Pappas up front, and she's Director of Behavioral Health. Mr. Wagner?
Whereas Mental Health Awareness Month is recognized nationally each year in May to bring attention to the crucial resources used to combat and overcome the stigmas surrounding mental health illness. In 2022, the theme of Mental Health Awareness Month, Together for Mental Health, highlights the need to join together in advocacy for improving the nation's mental health care system. And whereas this year, the Harford County Office of Mental Health is partnering with several agencies and organizations to provide wellness events through the month of May. These events include the screening of a documentary and a family wellness night. And whereas Harford County has a number of resources to help those who are in need of mental health services, the Office on Mental Health is joining with the Core Services Agency of Harford County to increase the knowledge of behavioral health disorders, raise awareness regarding the impact on our local community, and decrease the stigma surrounding behavioral health. Now, therefore, we, the County Council of Harford County, Maryland, on this 17th day of May 2022, do hereby recognize Mental Health Awareness Month, May 2022.
Thank you, Mr. Wagner. Andrew, my colleagues and I want to recognize Mental Health Awareness Month. We want to recognize all the good that you do and your team do for across the county. And I'd like to present you with this proclamation. Okay?
Thank you so much. Thank you.
Get a picture?
Let's all stand up.
All three of us.
Throw her off.
You need to come this way.
That's right. We're getting in on it.
You guys gotta come this way.
We're getting in on it.
You usually have us do this, Pat.
I know, I figured you would do it on your own.
I did eventually.
Would you like to say something?
I just want to thank the council and Council President Vincenti, as well as the community, for supporting mental health and all of our efforts. So thank you so much.
Agenda item number 5, consideration of petitions, applications, appointments, and nominations. We have none. 6, special presentations. Fiscal 23 Citizen Budget Advisory Report. Council, it's my pleasure to welcome Mr. Andrew Ondish and Mr. Robert Tibbs. I figured sooner or later you guys would find your way up.
Try to stay out of the front row when we can.
No, that's not true. Good evening.
Good evening, Council. We just wanted to take a moment this evening to share a little bit about what's been going on behind the scenes over the last couple of weeks here in the county regarding the budget. And we have put together a report that is comprised of 7 of us that have been selected to the Citizens Budget Advisory Board again for this year, for the fiscal 23 budget, and we've all worked with you here in chambers over the budget days that we've had recently. So good evening, Council President Vincenti, members of the County Council. We are proud to have been appointed the Citizens Budget Advisory Board for fiscal year 23. We feel it's important for the citizens of Harford County to know we are a board consisting of many different backgrounds with all knowledge of the county budgeting process. Our members are experienced in agriculture, emergency services, local government affairs, business, education, and finance. The fiscal year 23 budget brought another year with large revenue increases for the county to disperse. The county has also decreased the real property tax rate by a full 5 cents. We listened to 4 days of testimony from various departments heads and met as a group to discuss various matters related to the fiscal year 23 budget. Out of those discussions, we created this report, which we'll now present to you this evening. It is our hope that you will take into consideration our annotations as you move along in the budgeting process. The adoption of the real estate and income tax rates of fiscal year '23 would show a conservative approach and a needed decrease in the property tax rates. Revenue collections have allowed for many departments to receive full funding, which was unheard of even a few short years ago. As we continue to climb out of the pandemic, we commend the decrease in real property tax as a collection of funds can quickly turn wasteful, over-collection of funds. Fund balance has restored to $23 million, and the rainy day 5% fund is still preserved. The operating budget for fiscal year '23 is $943,645,000, and the capital budget is $269,052,000, for a total proposed budget of $1,212,697,000. The $1.2 billion total county budget is 14.9% higher than in that of fiscal year '22. The Board of Education budget was fully funded for fiscal year '23 for the second year in a row. Over the last few years, we have seen the Board of Education increase technology use for students all over the county. The use of federal funds, which allowed for the county to procure the devices and support plans needed, will continue to be a cost in future years. The improvement was needed and allows for the county to test by electronic means, which has become a requirement on the state level. The Citizens Budget Advisory Board recognizes the importance of our county heritage and agricultural advantages. With that being said, the Board of Education needs to budget and fund the purchase of the livestock trailer. It is important for the Board of Education to continue to monitor how potential Kerwin legislation will impact future budgeting. We commend the county administration for taking a proactive position on funding some of that obligation now instead of waiting to fund in later years, as we have seen in other jurisdictions. The Citizens Budget Advisory Board additionally commends Harford Community College for not raising tuition fees for the upcoming fiscal year. The county has also fully funded the sheriff's office budget, which should allow them to have the funding to fill much-needed positions. The problem we have heard with the emergency services is that candidates do not meet the requirements. The problem that we have heard is that, yes, the candidates do not meet the requirements of those organizations and the training that's needed. We heard multiple times that in many cases, the same applicants are being sought throughout the different agencies. The Citizens Budget Advisory Board discussed offering additional training programs to grow the applicant pool and decrease vacancies. As we see with the Sheriff's Office, an academy helps to train correction and patrol officers, but creative programming is needed to also assist our volunteer fire and EMS companies to fill positions. Having the ability to acquire proper certification will be paramount in keeping our emergency services staffed at the level our county needs. We challenge the county and other local jurisdictions to work together to solve the issues and make these programs available in the evenings to those who cannot always attend them during the weekday or weekend. Another item brought up during our deliberations this year was the increase in the item for miscellaneous grants. It seems like year after year, these grant dollars become increasingly difficult for the public to get access to review. As these funds are taxpayer dollars, we should have some oversight on the grants awarded, and at the very least, they are made public. We have seen them scattered throughout more budgets than in the past. When we are provided lists, it typically comes from a few of the departments rather than a comprehensive list. Citizens Budget Advisory Board is asking the county administration to publicly post these lists or establish a board that helps with the oversight of these funds. If they are not being spent, then why are they being budgeted, as they simply fall to fund balance and do not support the public as they are intended? The board also acknowledges a lack of funding for programs to support organizations like the Harford Center and the ARC. The county has a real problem if we cannot get our participation back to pre-pandemic levels to support these programs. We heard that they cannot hire as the funds that they have do not allow them to match competitive salary requirements, which in return forces them to help less people. This, in our opinion, is the wrong approach, and we should be adding to additional funds to their budget. These organizations need to be able to hire just like other departments who are fully funded. The Citizens Budget Advisory Board feels strongly that the Harford Center and the ARC need an increase in their budget to find highly qualified people to keep these programs and organizations running. Not doing this will be detrimental to these important programs. We commend the administration for working with our local health department for additional funding. All of us are convinced that the health department has guided us through a time no one saw coming. We understand funding comes from multiple sources, but we ask to keep funding them at appropriate levels so they may continue to serve our county in the best way possible. The board also took a hard look at how the county estimates revenues. It is no secret that revenue has risen significantly over the last few years, but we feel those revenues still might be underestimated. We ask that if this is happening, the county continues to find ways to reduce taxes and only collect what is needed to continue to fund county departments. The Citizens Budget Advisory Board felt like this year we reviewed very little of the capital budget. We continue to ask the county to make projects a priority for the needs of our citizens and to not serve political interest. We also need to keep contractors and project supervisors accountable for the problems that occur after completion. We still have issues at the Abingdon Library, and we feel we need to go back to see if the design had flaws that caused larger problems that need to be corrected. It is important for the citizens to have a say in this process of the county budget. We would like to continue to encourage citizens to utilize public hearings provided by the county, as a public participation is crucial in this process. I would like to thank you, the members of the council, for allowing the Citizens Budget Advisory Board to serve another year in our current capacity. You do make us feel welcome. We will continue to be of service to you as you complete the amendment and voting process, and I can take any questions at this time. And I'm also going to let Mr. Tibbs say a few words as well.
Well, I want to thank the council for the privilege to serve on this committee. It really, I get a lot of comments from people while you're on the Budget Advisory Committee, what's going on? And I think that's important for the county. However, people can show up at these meetings that we have, and I understand only 3 showed up this past week, and last week there were none. But we need to keep that meeting going forward, and maybe, I don't know how you get people out. Only time they come out is when they want to complain about something. So maybe that was a good thing that they didn't come out. And you all know how adamant I am about the magnet program at Harford, North Harford. And I would like to invite each one of you, if you haven't seen one or haven't gotten an invitation yet, on Thursday, the 19th of May, this is coming Thursday, from 6 to 8 p.m. at North Harford High School. The program will feature all the students and their activities that they have done, the magnet program students, all the activities that they have done, and their final presentation before graduation. And if you've never seen that, it is worth your weight in gold just to get there, just to walk through and see what these students do. They are actually probably, and I've been told that some of the college students can't do work that these students are doing, and it's very much in their behalf to have some politicians there to look at them and understand what's going on. And as we said here, some of the budgets that for the ARC, we would like to see some increase in those. That was almost unanimous, and that's up to the administration, I know, or to you guys to look at that. So with that, thank you very much.
Thank you, Mr. Tibbs. Thank you, Andrew. Council, any questions for Andrew and Mr. Tibbs? Mr. Schroes.
I really just want to thank my budget advisor, Bob Tibbs. He's been my advisor for a very, very long time, well over a decade, and just want to thank you. This is my last budget, and just appreciate everything that you've done. And I'll second everything that you said about the Ag Natural Resources Program at North Harford. It is a wonderful program. I do encourage anyone out there that to come out on Thursday to see their capstone projects and to see their graduation. They do a fantastic job. They work really, really hard. And I'm pulling for you on this ag trailer. I've already been talking about it, so it's one of the last things I want to do. So,
Well, it's very important because biosecurity is one thing. Well, I mean, they can borrow a trailer, sure, but the students don't understand that you have to keep these trailers clean to keep your diseases down. And I think that's part of learning, and that's what we need there. So,
right.
Thank you.
Well, thank you for everything, and thank you for your whole board's work. Appreciate it.
And I think, Councilman, you touched on something that all of us should look at as we move forward, is that this is an election year. It's no surprise to any of us at the end of the day. There's certain councilmen not coming back, and this board can look very different. So I would also like to take a moment to thank a good friend of mine and Mr. Tibbs, who has served in this as long as I have, and hope that some of these faces can stick around. But that, obviously, as we all know, is up to the council member. So
I'll put a good word in for him.
Unless some of these want to get off, as I was talking with Mr. Williams earlier today, who might say, well, yeah.
Thank you, Mr. Schroes. Mr. Woods?
Thank you, and once again, as always, thanks for the presentation and the information. It's always very helpful. And I have, of course, Dave's been with me since my first day on the council, so he was my assistant fire chief when I was fire chief of Fallston, and he's been incredible this whole process, and it's always been helpful and willing to help and be a part of the budget. So on the next food truck event at Fallston, I'm going to give him a little proclamation for thanking him for doing this. It's not the best or most fun thing to do every day when you're out here with us, but it's very helpful, and I appreciate each and every one of you. So thank you.
Thank you, Mr. Woods.
I need one of those for Bob.
Anyone else? So I want to thank you not only for the presentation, Andrew and Bob, but I want to thank you, Andrew, for the entire time that I've been on the council. You've been my budget advisor, and it's not just during the budget. You and I speak numbers on a regular basis. We dive into money spent, money budgeted. You give me a full understanding of what it takes to operate the county over the course of the year. And I know that you work closely with both Robbie and Kim and Kristen. We appreciate the service and the role that you guys do for the county. So just want to say thank you. Look forward to being here again. So thank you guys very much.
And I just wanted to also commend the finance team here, and they are amazing. And this report was drafted by all 7 of us, as you know, and even so I read it verbatim to be fair to the group. But I do want to clarify a point. The miscellaneous grants, a lot of those were provided to the group. So we just are hoping maybe we can go a step farther and put those out to the public as well as we go. And I understand it's in the middle of the session when we're doing this, and the budget is not closed for a year. And I think that's also important for the public to know, is we're in the middle of a budget while we're approving another budget,
Right.
which is a tough timing for them. So they have done an incredible job. They put together a document that was 40-some pages long that we were able to review. So we do want to thank Kim and her team, and where the future holds with all of you guys as well is, we are very thankful for all this as well. So thank you. I very much appreciate you bringing them up as well.
Thank you very much. Thank you. Appreciate your presentation. Thank you, gentlemen.
Thank you, gentlemen.
Agenda item number 7, approval of minutes, fiscal year 23 budget, public hearing, May 4th, 2022. Legislative day 22-015, May 10th, 2022. Fiscal year 23 budget public hearing, May 11th, 2022. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Agenda items number 8 and 9, we have no business this evening. 10, introduction and consideration of amendments. Mr. Wagner, please read in amendments 1 through 14 to Bill 22-009 into the record for introduction, please.
Amendments to Bill number 22-009. Amendment number 1, introduced by Council President Vincenti to request the county executive. On amendment number 1, on page 40 in line 6, strike $1,900,000 and substitute $2,600,000. This increases the state program open space in the amount of $700,000. Amendment number 2, on page 41 in line 4, strike $1,075,000 and substitute $1,775,000. This increases the Parks and Recreation Capital Project parkland acquisition in the amount of $700,000. Amendment number 3, on page 40 in line 6, strike $1,900,000 and substitute $2,100,000 to increase state program open space in the amount of $200,000. Amendment number 4, on page 41 in line 8, $200,000 and substitute $400,000 to increase the Parks and Recreation Capital Project tennis multipurpose pickleball courts in the amount of $200,000. Amendment number 5, on page 40 in line 6, strike $1,900,000 and substitute $2,406,315 to increase state program open space in the amount of $506,315. Amendment number 6, on page 41 in line 1, strike $2,150,000 and substitute $2,656,315 to increase the Parks and Recreation Capital Project P&R facility development renovations in the amount of $506,315. Amendment number 7, on page 40 in line 5, strike $500,000 and substitute $2 million to increase state funding in the amount of $1,500,000. Amendment number 8, on page 41 in line 5, strike $175,000 and substitute $1,675,000 to increase the Parks and Recreation Capital Project playground equipment in the amount of $1,500,000. Amendment number 9 on page 42, between lines 4 and 5, insert the following. Prior bonds, $213,955 to reallocate prior bond funds in the amount of $213,955. Amendment number 10 on page 42 in line 12, strike in parens 486,000 and substitute in parens 272,045 to correct the prior bond amount to be reallocated on the Water and Sewer Capital Project, Oakland Manor, Joppa Sewer. Amendment number 11 on page 42, between lines 4 and 5, insert the following. Prior bonds, in parens 213,955, to reallocate prior bond funds in the amount of $213,955. Amendment number 12 on page 41, in line 10, strike 786,000 and substitute $572,045. Amendment number 11 on page 42, I'm sorry, for that, amendment number 12, that is to correct the prior bond amount reallocated to the Water and Sewer Capital Project, which is the Brentwood Park Pumping Station. Amendment number 13 on page 42 in line 5, strike $9 million and substitute $9,215,000 to increase future county bonds in the amount of $215,000. Amendment number 14 on page 42 in line 10, strike $786,000 and substitute $1,001,000 to increase the Water and Sewer Capital Project Brentwood Park Pumping Station in the amount of $215,000.
Thank you, Mr. Wagner. Please read in memorandum of change 1 to resolution 017-22 in the record for introduction.
Memorandum of change number 1, the Bynum Run Watershed Restoration. This memorandum of change will add $500,000 in state grant appropriation authority for fiscal year 2025 and fiscal year 2027. This change will support the final assurance plan for MDE.
Thank you. Agenda item number 11, call for final reading of bills. Bill 22-006, zoning code cidery. May I have a motion? Mr. Wagner.
I would move for the approval of bill number 22-006.
Second.
Thank you, Mr. Beulah. It's moved and seconded to approve bill 22-006. Any comments? Ms. Dixon.
Mr. President?
Aye.
Mr. Woods?
Aye.
Mr. Schroeds?
Aye.
Mr. Wagner?
Aye.
Mr. Beulah?
Aye.
There being 5 votes in the affirmative, 2 absent, Bill 22-006 is hereby approved. Agenda item number 12, enrollment of bills. Bill 22-006, zoning code cidery, is certified as being the text finally passed. 13 and 14, we have no business. We're going to skip 15 for a second and go to 16, business from council members. Mr. Woods.
Nothing tonight, thank you.
Thank you, Mr. Woods. Mr. Schroeds.
Yes, thank you, Council President. Just a few things. Just want to congratulate Rosemary Hajek, my dear friend, on receiving the Joe Ryan Champion for Prevention and Recovery at the annual ACR event. That for those that don't know, that's Addiction Connection Resources. And anyone that knows Rosemary is, she is somebody that gets behind a lot of efforts in Harford County for many great causes, and she does serve on the board of ACR, and she was given the Joe Ryan Championship Award this year. Also, they honored our county executive, Barry Glassman, on being the Good Shepherd Award for all the efforts that he's put into our addiction issues in Harford County and the financial support that he gives to many nonprofits. I had a couple fun things to do over the weekend as well. Gordon Rems Snyder turned 100, and I was able to be at his huge party up at Geneva Farms, and he's just doing really well. Believe it or not, he still mows his grass at 100. I tried to go by today. He said he wanted to mow yesterday, but I knew it was kind of rainy, and I missed him today. I kind of cut through that way, and he had mowed like all of his property already, so I am going to stop by and see him. Also, over the weekend, John Archer celebrated their 50th birthday celebration. Hats off to them, all the staff and teachers, paraeducators, volunteers, our community that supports them financially, very generously. They just do an amazing job. It's such a close-knit school. Many of their students start as early as age 3, and some of them don't graduate until age 21 to 22. So it's a very close-knit school, and the parents and everyone are so tight, and I just love being there. It was great, and got to see the mayor of the school, Mikey, and he's 33, and he was just fun to be around. He was very excited and emotional because of what great things that John Archer had done for him. Also want to congratulate David Glenn on wrapping up his time as being council president and council member at the city of Havre de Grace. I know that he cares about his citizens very much, and I know that he just finished his last meeting last night. So I wish him well in his future endeavors. And that's all I have tonight. Thank you very much.
Thank you, Mr. Schroes. Mr. Wagner?
The Mental Health Awareness Month proclamation that we gave out earlier this evening is very relevant in the fact that, especially after the pandemic and the children affected for one, but, adults as well, everyone was affected. And there are so many things that we can tie back to mental health. You put mental health at the top of that pyramid, and then you filter down, and so many things that we see in our society today and the ills that we have all relate back to the mental health. And, you can't stress enough to people that if there is something that you need to seek help, that help is out there. Certainly, try to get the help that you need before things spiral out of control. And that takes me to the point that, I think we should all keep people in Buffalo, New York in our prayers, because that type of activity could break out anywhere all across our land. And, so far, we're, knock on wood, we've been fortunate not to have something of that magnitude in our backyard. Some years ago, we had some issues, but, for now, let's, we just keep them in our prayers, and certainly that's a devastation there in Buffalo, and, be aware of the mental health issues that people have, and encourage those that you know to get help. Thank you.
Thank you, Mr. Wagner. Mr. Bueller?
Thank you, Council President. Just one thing. I also just wanted to thank Council President David Glenn, City Council President, let me clarify now. City Council of Havre de Grace President David Glenn. I want to thank him personally for his service to Havre de Grace. I've been blessed and honored to work with him during my time on the council, and I know that he really cares about the community, and everything he does is from the heart. And even though he's retiring from public service, something tells me that I will be hearing from him in the very near future on issues. He's just not one to totally step away, in my opinion. So I just wanted to thank him personally for all his many years of service to Havre de Grace and really the whole county. So thank you, David Glenn, and may God bless you in your future endeavors.
Thank you, Mr. Bueller.
Thank you, President.
And then agenda item number 15, business from the president. As I said earlier, I had an opportunity to get out in the field with the health department. We hear so many different issues and challenges that our citizens, our businesses, and our health department face on a daily basis. And I just think it's the right thing to do is to get out in the field and truly understand what they're up against and what they do on a regular basis. I want to thank Ms. Harris for representing us at the 17th Annual ARC Gala. She tells me that they exceeded their fundraising goals, which was $30,000. They actually raised $43,000 for their clinical team and mental health services, so congratulations to them. Saturday, I had an opportunity to attend a fireside chat at the Decoy Museum for Troop 238 from St. Ignatius Church. And there were about 40 scouts. And we talked about many things, but we talked about our local heritage, waterfowling heritage. They had an opportunity to go fishing. They had an opportunity to visit other museums in the area. They camped on the grounds for 2 days, cooked. It was a great experience for them and for us as well. We actually attended the Charlie Raleigh Foundation golf tournament. That was a huge success again, even with a little bit of threatening rain. So want to give a shout out to them because they do a lot to provide scholarships for many of our students in the county and our first responders as well. And then on a personal note, sadly, this past Sunday, my Aunt Tina passed away. She was my mother's youngest sister and the youngest of 11 children. She was an outstanding cook, quick-witted, and she was survived by her only sister, my Aunt Rose Hamilton. So her 3 daughters as well, Franny, Paula, and Debbie. So I'd ask all of you to keep them in our thoughts and prayers. And with that, agenda item 17, comments and input from attending citizens. Ms. Dixon, do we have anyone signed up?
We do, Mr. President. We have 7 this evening.
With 7 speakers, again, we'll stick to our time limit of 3 minutes. And again, be respectful of one another and call your first speaker.
John Malamo, followed by Eleanor Dutter.
Good evening, sir.
Sir, good evening to your colleagues, to you and your colleagues. John P. Malamo, 2402 Eagleview Drive. I find it laughable that you and the county executive have concern about the legality of your zoning and land use activities. If Bill 22-003 is illegal, then by extension, all zoning and land use actions would be illegal as well. Nonetheless, considering if Bill is illegal, then it was not made so by the county executive veto or when outside counsel declared it so. It was illegal when it was written. Who did the legal review for sufficiency on that bill? As a consequence, Councilman Beulah, I have no confidence in any statement you make or action you take. Worse, you led your colleagues who trusted in you to have it right down a path to an erroneous conclusion. Their mistake. They trusted you. Too bad for them. At this point, I have no confidence in them either. On another issue, there's a question on the contents of the package sent to the county executive, specifically the presence of a map. I can state unequivocally and with great certitude there was no map in the package. Anyone wish to debate that? Please call me. There are some elements common to maps: title, scale, legend, compass, latitude and longitude. None are present on the diagram marked as Amendment 1 to Bill 22-003. Amendment 1 is not a map. That situation could have been brought to cure by constructing a legally sufficient map in conformance with standard cartographic procedures, or simpler, call Amendment 1 a diagram. Either would require an amendment to the bill. Please note, commonly used terms incorporated into discussions and documents are constrained to observe commonly accepted definitions. On 12 April 2022, I graded your efforts as a county council. Your efforts on Bill 22-003 surprised me. I did not think it possible, but you set a lower standard for yourselves than I did for you. I know this: God loves us all, but God will not countenance nor save a slovenly soldier. Harford County should neither countenance nor suffer slovenly governance or government. You and the county executive have embarrassed yourselves and disgraced the institutions of government and governance. Good night.
Good evening, ma'am.
Good evening. Thank you. My name is Eleanor Dutter. I live at 1806 Park Beach Drive, Aberdeen. That's in Perryman on the shores of the Bush River. Good evening, gentlemen. Perhaps you have heard in all this falderall that the Protect Perryman Peninsula organization is composed of young, rich, young waterfront homeowners. Obviously, I am not young. My husband and I are pensioners. We are not rich. We own waterfront property, but we are not new. Our property was purchased by my grandparents in 1924. I was a summer resident and river rat from 1946 to 1966, where I learned to swim, boat, ski, fish, and crab. On Saturday mornings, I sometimes would walk a sandy Canning House Road to buy Mitchell's shoe peg corn at the weighing station for our Saturday feast of fresh corn and Bush River crabs. After 1966, my husband and I were seasonal visitors, but we became permanent residents in 1998. That is 98 years of property ownership by my family on the Perryman Peninsula. Over the past 5 months, I have heard some of you speak reverently of landowner rights. Do I have any rights? Don't seem so. Do I have the right to breathe relatively clean air? Or can a neighbor force me to breathe a miasma of toxic diesel fumes? Do I have the right to travel to Route 40 relatively safely? Or does that same neighbor force me to navigate a gauntlet of thousands of speeding tractor-trailer trucks along narrow two-lane roads and dangerous intersections? Doesn't the council have the responsibility to promote the health, the safety, and the welfare of all citizens of this county? Finally, it is debatable that the proposed mega warehouse, freight distribution, and manufacturing center is light industrial development. It is my understanding from testimony here and quotes in the newspaper that if this council even questions the developer's interpretation of LI, the developers will sue. If that threat intimidates our government, then it has gone beyond business friendly to business subservient. Please note that the Perryman community does not oppose the landowner developing his property, but does strongly object to the proposed development that is clearly a threat to us all, and we will continue to oppose it. That includes lawsuits. You will hear from us educated idiots, as you so called us, again and again and again.
Thank you, ma'am.
Emma Peller, followed by Ron Stuczynski.
Good evening.
Good evening. Emma Peller. My address is on file. Thank you, Council, for the opportunity to speak again tonight. I'm here to speak about the rules of procedure for the Harford County Council, specifically Section I, Public Participation. Subsection 4 under this states the following. Comments permitted to be made by citizens during agenda item number 17 are generally permissive, except that matters which are the subject of a public hearing, such as bills, may not be addressed until the legislative session day which follows final action on the matter, and pending zoning cases may not be addressed until concluded and the expiration of all appeal rights has occurred. My question is this: what is the purpose of this rule? Why can you come and talk about conspiracy theories or things that have nothing to do with the council, but not an issue that you will vote on within weeks? It seems to me that the council is beginning to recognize the problems with this rule, as they have generally ignored it over the past few months in relation to Bill 22-003. I would ask tonight that you as a council look at this rule and consider changing it to allow citizens to discuss any issues that are troubling them, including and especially bills that will be up for a vote soon. Thank you.
Thank you, ma'am.
Good evening.
Good evening, sir.
Ron Stuczynski, address on file. Chad forgot to mention the SARC event on a Saturday night was an excellent event as well. I just wanted to bring that up. Just going to remind council of a few quotes we've heard in the last few months. What we don't need more of are warehouses on the Perryman Peninsula. I'm pro-smart development, and I feel it needs to be safe for the citizens and not be a negative impact on quality of life. I've got more traffic complaints from Perryman residents than all the rest of my district combined by far. As a county officer, we are charged with upholding the county code and charter. Both are based on the health, safety, well-being, welfare of our citizens. Anyone with common sense can tell you that Perryman right now cannot handle the traffic it already has. It's dangerous and ludicrous. For 2 decades, the quality of life has gone down in Perryman. The environment needs an updated study. Safety needs a study. This project shall not move forward until there's alternative exits and entrances. I'll put this to anyone. Would you want to live next to 5.2 million square feet of office and warehouse space with tractor trailer noise, light, and pollution every day? Then you said, oh, by the way, this is Mr. Beulah's quotes. Like our county executive said, we need to put our citizens, our people first, their safety, well-being, and quality of life. Then you gave a sincere, heartfelt thanks to all the residents of Perryman as you cried. Said you were honored to be our councilman. Then you said you have not talked to one person that actually supports this project. Curtis, I ask you, in the beginning on January 11th, you said you were working with council attorney on what could be done. After 5 months, we heard nothing about what the council attorney told you what could be done, but within 24 hours of Barry Glassbow vetoing our moratorium, you had an answer from him on what could be done for us, which as of right now is nothing. So it's very disappointing the way things have gone down for 3P and our group being shut out. I think we feel like our voices weren't heard. I do thank Mr. Johnson for his apology last week. A little late, it doesn't help us now. And I also heard that we were referred to as 3P, a group of educated idiots. Doesn't feel good to hear that, but what I'll let you know is the educated idiots are about to put school in process. So I ask you to buckle up, get your pen and paper, because there's going to be a lot of learning that's going to be done in the next few weeks. Thank you.
Bill Wayland, followed by Christina Trotta-Pekovic.
Good evening, sir.
Good evening, Mr. Vincetti and council members. Maybe you can, thank you. I was baffled by the sequence of events and the actions and inactions leading up to the veto of 22003. That's why I sent an email to each council member asking some basic questions related to the moratorium introduced on February 15th down to the veto on May 2nd. To date, I've received no reply. It's typical of the administration. Let's go back to the public hearing on this bill on March 15th. Ms. Lambert from the Law Department. The use of the moratorium was not permissible. The bill was irreparably flawed, and the administration would not support it. 3 outside lawyers spoke to the illegality of the bill. Chesapeake Realty threatened aggressive legal action if passed. Of course, there were all the citizens who were in favor of the bill. I believe this should have set off some bells and whistles. I questioned the council if there were any attempts to determine from the law department or outside entities why the bill was illegal. There was time to do this in the days following the public hearing. On April 19th, 5 weeks after the public hearing, the council approved the bill and amendments. Mr. Wagner stated the most legal thing to do was to vote against the bill, but he voted for it. He obviously knew there were legality issues. On the same evening, under new business, the council approved an outside law firm to provide a legal analysis of an issue related to legislation. No doubt that this issue was this bill. I fault the council for waiting 5 weeks to seek any legal counsel to determine the legality. I believe the council knew the bill was going to be vetoed by the executive. Instead, it appeared the council wanted to move forward. Oh, let's appease the Perryman Peninsula citizens, and let's make the county executive the bad guy. I fault the county executive for waiting until May 2nd to veto the bill, 1 day before the legislative session. I questioned by letter to him on May 9th his honesty, his sincerity, his poor leadership based upon his petty and absurd reasons for the veto, based on my own personal experience with him and the administration on many other matters. The Perryman Peninsula citizens had high hopes the council would take action to override the veto on May 3rd. Instead, there was no action taken to override the veto or even a discussion. That's wrong, and that really hurts your credibility. On May 10th, yeah, Mr. Johnson apologized, and Mr. Bueller said the outside counsel came back reporting the moratorium was illegal. He said there was no real support to override that. Let me conclude with the following. The word action has several meanings, one being the exertion of power. I made up my own meaning for each letter of action. A, accountability. C, credibility. T, transparency. I, integrity. O, open-mindedness. N, nerve. Unfortunately, my experience with the administration and the council, this doesn't exist. Thank you.
Good evening, ma'am.
Good evening. Thank you. Christina Trotabakovic, address is on file. I have not spoken testimony lately because there was nothing left for me to say to you. However, after touring Perryman this weekend and seeing all the development continue to rise daily, seemingly in record speed, I felt compelled to remind the people of this community who is in charge, regardless of what you say. Knowing your days are limited in these seats, it seems your special interests are quickly trying to cash out as many new signs of development, particularly in Bel Air, are displayed. You have sold out Harford County to the highest bidders with not a spot left of green to be found in my district. You call yourselves Republicans, but we all know what you really are. You cater to special interest groups and do not care about this community. That is evident by the mass influx of nonsensical development that has been on the rise. Projects that only benefit developers and their intentions to urbanize this once beautiful, serene county, which now feels and looks like Biden country. These same developers are donors to you and some candidates who openly use the same folks as their campaign managers and or advisors, who host fundraisers ranging up to $1,000 a person while sitting on boards that benefit the business of such developers. Talk about a conflict of interest. We tried to warn Perryman. Unfortunately, they had to learn the hard way, as you strategically waited until the filing deadline to hand them a slap in the face. You will go down in history as those who put the final nail in Harford County's coffin. There is nothing we can do from this council days are over. We know your intentions. You in the past council may have bought and sold this county to a point of no return, but the real patriot candidates will do their best to clean up your mess when they are elected and sitting in these very seats. Hope to see you at the next debate, President Vincenti, and anyone who has not yet responded. The people deserve to hear from you. Have a great evening.
Our last speaker this evening is Holly McComas.
Good evening, ma'am.
Good evening. I would like to just extend a personal invitation to everybody, all the politicians that are listening to this, to all you gentlemen. This Saturday, we are having a yard sale trail down in Perryman. We have a historic trail all mapped out for people to learn about Perryman and the beauty that it holds. And that's going to be Saturday morning. Starts about 8 o'clock and it goes on until no one else is there. So I extend that invitation to you all. Thank you.
Thank you.
There are no more speakers, Mr. President.
Thank you, Ms. Dixon. When no one else signed up, this will conclude the meeting.